Hello and welcome everyone. Welcome to one more lecture of pediatrics, and it's a very important lecture. It is about failure to thrive or FTT, which I'm going to use a lot during my next lectures because now we are already out of neonatology, so a lot of conditions we are going to talk about failure to thrive. So the first and the most important thing that failure to thrive is not a disease, okay? Failure to thrive is not a disease, rather, it's a term which is used to describe suboptimal weight gain in infant and toddlers. Failure to thrive, failure to thrive, okay? So the we always write it as FTT. So remember, it's a term to describe suboptimal weight gain in infants or toddlers, okay? um, Now, what is a suboptimal weight? That's a very important thing to understand, and to understand that, the important thing is to define when we say that someone have suboptimal weight gain. So by definition, failure to thrive is when the weight of the baby is less than third percentile, okay, or falls across two major percentile curves. Or one more definition you can say, or the weight of the baby is less than 80% of expected weight for height and age. Now see, either the weight is less than third percentile, or either the weight falls across two major percentile curves, or either it is less than 80% of expected weight for height. Now guys, to understand all these things, again you must have a good concept about what is percentile. And if you don't have the concept of percentile, I'm sure you can never understand this thing. I show you the um, the chart which we plot for the weight and for the height, right? So if you remember on the chart, by the way, maybe I can show you here. If we can find that chart over here, that would be best for us. But wait, I'm going to find that chart over here maybe. Okay, wait, maybe this one will work for now. See, well, this is not that chart. If you remember, like the chart I'm talking about, I show you, like we chart the weight and the height, okay, and I show you that different chart for the boys and girls. So what happens in the chart, basically, there is 50th percentile line, and then there is 93 percentile line, 97 percentile, and 3 percentile. What is percentile? A percentile is basically, for example, if I'm saying that, um, as there is 30 percentile, what it means, like, it shows that 30% of the people, they are below this level, okay? Or if it is a 50 percentile line, and if I will say that the person is marked at 49 percentile, which means, like, most of the people, like 49% of the people, they are below this line, right? So that those chart have different lines. So for example, uh, someone who was going like this, and suddenly, he started dropping, and he started crossing two lines which are drawn on that growth chart. So that means, that there is failure to thrive, or someone who is below the third percentile line, or someone who is, what you can say, less than 80% of what is expected to weight for height and age. um, you can see over here, again, this is a very good presentation for like a chart, just to explain you what is percentile. This is the 50th percentile, and this is the one deviation, two deviations, not this one, this is the two deviations, okay, two standard deviations, okay. So see, this is like most of the people, they are at this, or they come in this section, right? So there are very less people, who go like here or here. For example, if we will say that, um, the average height of the world in the world is, for example, 6 feet. So 6 feet will come here. Then, for example, 5 foot 4 inches will be here. 6 foot 6 inches will be here. And then there are people who are like 4 feet, and there are people who are like 8 feet. Okay, but see here or here, there will be very few people, right? So anyhow, like, if you don't have a good concept, guys, like, try to watch any lecture or develop the concept of percentile and all these things, because like the things will be difficult for you to understand if you don't know the concept of percentile. So as I told you, like, failure to thrive is a term which is described as when there is suboptimal weight gain in infant or toddlers. It may also be referred to as weight or growth decrease or fluttering in parents. Consider the term critical for their care, right? The important thing here is uh, the most common cause of, you can say, failure to thrive is, decreased calorie intake. uh, like what happens is, mm, you know uh, generally when the babies are born, there is a normal weight, or normal, not normal weight, rather there is a normal weight range. Like, if the baby weight is more than 4.5 kilograms or 4500 grams, of course they are considered as, like, overweight. So same things like this. So for example, at 1 year of age, we expect the babies to be around 10 kilograms of weight, or 12, or 9, or 13. But for like, what if at 1 year of age there is someone who have the weight of around, you can say, 20 kilograms? That's too much. Or what if, like, someone at 1 year of age have a weight of 6 kilograms? That's again is too much, like, too low, right? So uh, between, like, from the time of the birth, or you can say from 6 weeks of their life to 1 year of their age, only 5% of children cross like two lines when we plot the growth chart, and only 1% of the babies, they cross three lines. Okay, like they show a very, you can say, a different type of, uh, like, what I'm talking about is, I will show you later, like that thing. So simply, what happens, whenever we found some baby, who is like either less than third percentile, their weight is falling less than third percentile, or they cross like two major percentile lines, okay, which only 5% of the children from 6 weeks to 1 year of age cross, by the way, or their weight is less than 80% of what is expected for their height and weight age, then we call it as failure to thrive, okay. And the most common cause of that thing is, as I told you, is inadequate calorie intake, okay. Of course, like, there are different reasons of inadequate calorie intake. Like, in poor countries there is poverty, or someone is not getting good food. And for example, if the baby is having some medical conditions, like they cannot cleft palate, for example, and they cannot, like, they don't have the sucking power to suck the milk. So of course, like they will be taking less calories anyways. Okay, so so now the thing is, of course, like we keep on examining the babies, and based on that repeated examinations, we either decide the baby is having failure to thrive or not. Of course, like not just on like one thing is, for example, the small mothers and fathers, of course, like when the height of when their height is small, so of course their baby height will be small. Or there are families who are generally big families, and there are families who are all fat. So things, of course, because the things are in genes as well. So of course, like um we keep on checking, we keep on plotting the graph again and again at repeated, like at defined time, and then we say that okay, either the baby is having this failure to thrive or not. So for example, if you are seeing a baby from you can say first day of his life or first month of his life, and now you found like before his weight gain, like his weight was going good, but now his weight is decreasing, so of course you will start thinking about that there is something, going on. Okay, so something. Okay, yes, I found it, found the thing, so I can show you over here. Mm, this one I was talking about. So you can see this one, like uh, what is going on is uh, when they have plotted the weight in kgs and the age in weeks. So this is the 50th percentile line, and this one is the 75th percentile line. This one is the 91st percentile line. This one is the 98th percentile line. So what they were talking, like what, like that definition, according to the definition, you can see. For example, like this one, see someone who is he is below the, this is the second percentile line, so he is below the third percentile line. So what you will say, he is showing not a decline but a linear type of fashion, but his weight lies at lowest level, right from the start when we started plotting the growth chart, right? For example, someone is showing this behavior, like his curve is going like this. So what he's doing, like he's crossing two or three lines. So of course, like before he was fine, but now he's declining. So it means also failure to thrive, right? So this is like how we plot the growth chart, and how we decide like either the baby is having any trouble or not. So uh, now failure to thrive is like when they don't have enough weight gain, and failure to grow means like when they are not gaining enough height, right? Not enough, like the normal, you can say. So like most of the babies, who have FTT or failure to thrive, by the way, they usually maintain their height, but maybe like if that the weight gain will become severe, or it is due to some condition, so maybe like later on they cannot even maintain their height, like they will become small. So how we can classify, or what are the causes of failure to thrive? Okay, now the important thing over here is, for that I'm going to show you a very nice, you can say, table which is showing what are the causes of failure to thrive. Okay, look, you can see in this one, um, as I told you, the most common cause is calorie intake, like decreased calorie intake, right? So uh, I'm sorry. Okay, so mm, okay, now I think it will be clear, right? So the most common cause is decreased calorie intake. They may have nutritional deficiencies like vitamin D deficiency, protein deficiency, iron deficiency. Now, like when there is a problem with the vitamin D, the people, they may have a condition called as rickets. Whenever they, like the people, like anyone is deficient in protein, they have uh, protein energy malnutrition, right? Then there is a condition called as kwashiorkor. So different conditions are there, simply. Okay. So there are different factors, of course, like which play a role, like physical, like genetics are there, intrauterine factors can be there, what happened before birth or during pregnancy, nutritional factors is there, endocrinal factors are there, chronic infections can cause, and psychosocial factors can cause. So one way to remember, a very good mnemonic, by the way, uh, to remember the causes for failure to thrive is we can divide them under 3 or 4 categories. You can see over here inadequate calorie intake. If you will see over here, the first one they say is like non-organic, and this section talks about the organic causes, right? So what are the non-organic causes? Inadequate availability of food, which could be due to feeding problems like insufficient breast milk, insufficient or unsuitable food offered, and lack of regular feeding times, or infant difficult to feed, resist feeding, conflict over feeding, problem with budgeting, shopping, cooking time, or famine, of course, like nowadays, of course, just in few countries, low socioeconomic status, maternal depression, you can say, poor maternal education, child neglect can be there. Okay, if you will see the organic causes here, what you will find is impaired sucking reflex, like for example cleft palate, which I was talking about, or the child have cerebral palsy, chronic illness leading to anorexia like Crohn disease, chronic renal failure, cystic fibrosis, liver disease. So one thing is inadequate intake. Now second thing is um, the baby is taking the things fine. So you can remember it by this way, that number one, the baby is not getting enough. Number second, the baby is getting enough, but the things which he's getting are not staying inside. Whatever he is taking, is basically vomited out. So inadequate retention. Third thing, the baby is taking enough, the things are staying inside, but they're not absorbed. So if they're not absorbed, they are useless. So there are many conditions like celiac disease, cystic fibrosis, cow milk protein intolerance, liver disease, short gut syndrome, and post necrotizing enterocolitis. You remember, like we already covered this topic. Fourth thing, the baby is taking enough, it is retaining, it is absorbing, but the demand is more. Okay, so when the demand is more, you can see over here, for example, thyrotoxicosis, hyperthyroidism, malignancies, chronic infections, congenital heart disease, chronic renal failure. So all these things, right? Demand is more. Or the baby is taking, retaining, absorbing, but cannot utilize what it's like is already absorbed. Like maybe the baby have any metabolic disorder, amino acid disorders, storage diseases, right? So things like this. So these are the causes for what for um, like failure to thrive, right? So now the important thing to what you can say to remember, like in this one, is we know the definition, we know the causes, is like how we can know, or history taking, like how you will inquire the guardian, which is of course like mostly female, or the mother. So like of course a detailed history is needed, including like the food diary, what the baby eat, like feeding, how they feed, how much they feed, what kind of feed they gave, right? So in pediatrics, we ask like good baby question and bad baby question, or like sick baby questions. Good baby question, like if the child is eating well, pooing well, peeing well, all these things. So uh, yeah. Then we can ask about things like any chronic diseases. For example, we can, okay, now see, we are asking in the same way what the child eats, so how much you give. So we are taking the taken like the like intake. Then we will ask like either there is any vomiting or not, so we will check the checking the retention. Then either the child is having any diarrhea. Why? Because if there is malabsorption, of course the children they present with diarrhea. So is the child with energy, or does the child have any other symptoms like diarrhea, vomiting, cough, lethargy, things like this? And then we ask about if there is any chronic diseases, right? So things like this. Past illnesses you can ask. Then remember, never forget binds. How was the birth? What happened during pregnancy? When the child was in intrauterine? When the child was born, when you will ask about birth, what was the birth weight? Just to see like either the child was normal at that time or there was any intrauterine growth retardation. You can ask inquire about the growth of other family members. Very important. Any illnesses in the family. And then BI immunizations, and for nutrition, D is for development. Is the child development normal? And then we always check for the social history like SADMA. In this one, always ask about any psychosocial problems in the home, because maybe it's a single mother, maybe the mother and father they're not in good relations. So of course these all can cause problem with the uh, baby weight growth. Okay. uh, so unfortunately there is no way to take out what should be the ideal weight, because the weight varies a lot. It depends like how much you what's your lifestyle and what you eat, by the way, and your intake and everything. For example, we can calculate what we say something called as mid uh, parental height. Okay. For example, if like if a family will come to me, a mother or father, and they will say that my child is the smallest in the class, a very 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 common problem. So of course, like if I'm seeing that the father is 5 feet and the mother is 4.5 feet, so they can not have a 6 feet child, rather they will be having a child like of their height. So what we do, like we add the father height with the mother height, and we add 13 in that, and we divide it by 2. So that is called as the mid parental height. So for the boys and the girls, there is different formula. For example, for boys, what we do is um, we take the father height plus we take the mother height plus we add 13 and divide it by 2. And same thing when you want to do it for the girls. Uh, for the girls, what we do is like same thing over here. Copy, and this one should come here, paste. So just instead of adding 13, subtract 13. That makes the mid paternal height for the girls, right? So very very easy. But for the weight, we are helpless. We cannot do anything. So next comes the once you have done the history, then of course like we will go for the examination. And I always go like I always like try to go logically uh, in some sequence. Okay. So of course, like whenever we do go for physical examination, we check the vitals, we check the growth parameters, we take the height, we take the weight, we take the head circumference, we can take the arm span, and we plot it on the chart just to see how the baby is doing. Vital signs can be taken, and then we go for the head to toe exam. And one very important thing which we check in these babies is like we check for any dysmorphic features, like to catch any syndromes like Down syndrome and stuff like this. We check their upper and lower segment like body ratio, as well as we like if the baby is like not baby like a big child is coming, so of course you will check here their sexual maturity staging. So, or we always also check for any signs for maltreatment, any bruises and things like this. Why? Because maybe there is abuse going on. So of course, like if you know the causes, then in the examination you're going to look for those things. So you will from head to toe examination, what you will be checking is distended abdomen. You will check the buttocks, okay, buttocks. You will check any chest deformity is present or not, any signs of heart failures, any signs of nutritional deficiencies. And if you're suspecting a child abuse, of course, not in all the countries, but in developed world, like it's the doctor duty to inform it to the authorities and retain the child, and the authorities will come and they will question the mother and father. They will examine the child, but it's your duty to inform. Okay, so all these things are checked, in examination. And of course, like once you have done examination, then we go for the investigations. Okay, so if you will see over here, uh, I talk about the causes. Uh, there are different ways to check for the nutritional assessment of the babies. Okay, see, and so metric measures things are there. We can check the weight, height, mid arm circumference, and skin fold thickness. I always give the example of old times, like only the rich people can be fat, not the poor people, because poor people have to work a lot. So, skin fold thickness, many old people, they put their hands on the shoulder and see like how much skin or fats you have just to see. So, skin fold thickness is something like that, but like in a more medical way. So we can do some labs, like we can check low plasma albumin, of course, like in malnutrition, low concentration of specific minerals and vitamins, like vitamin D. We can check for the food intake, like we can ask them to tell us what they eat in the last 15 days or 1 month or things like that. We can check for immunodeficiency syndrome. So this is a normal. They are showing weight over age percentage 100, weight over height over age 100. This one is wasted when see the height is normal but weight is reduced, and this one is a stunted where weight over height percentage is maintained but weight and height both are reduced. Okay, so of course, like okay, one of the way to remember a mnemonic, to remember the features of FTT, failure to thrive, is also called a small kid. Small kid. So what is small kid, by the way? It's a mnemonic. Okay, to remember the causes of the signs of failure to thrive. So S is for subcutaneous fat loss. So when you will check them, you will find that they have very less fats. M is for muscle atrophy. L is for alopecia. Their hairs, they'll be having less hairs. L is for lethargy. Second L is lagging in developmental milestones. K is for kwashiorkor. It's a condition. I is for infections, of course, recurrent infections. And D is for dermatitis. So again, like it's a mnemonic to remember. Anyhow, we have to talk about the investigations, right? So of course, like after examination, we will go on to the investigations. Now the thing about investigations is, of course, we have to look for all the causes. Like if you remember the causes from the chart which I show you, we have to see like what kind of what you can say problem is there, right? So of course, like we start from the basics, like full blood count, differential white blood cells. Like you can see anemia, neutropenia, lymphopenia. You can catch immune deficiency, right? Then serum, creatinine, urea, electrolytes, acid balance, calcium and phosphate, which will tell you if the baby have renal failure, renal tubular acidosis, metabolic disorders, or things like this, right? Liver function test can be done. Like this will guide us, like if uh, there's any liver disease or malabsorption, metabolic disorder. Thyroid function test can be done for hypothyroidism. Acute phase reactant CRP can be done for inflammation, and ferritin can be done for iron deficiency anemia. Immunoglobulins can be done for immune deficiencies, and IgA tissue transglutaminase antibodies for celiac disease, urine microscopy and culture and dipstick for UTIs, stool microscopy culture and elastase for intestinal infections, parasites, karyotyping in girls to check for Turner syndrome, and chest X-ray and sweat test for cystic fibrosis. Uh, there are other investigations you can do also. You can do echocardiography for um, look for the cardiac conditions or congenital disorders. Uh, yes, so these investigations should be done in all the patients, who are suggesting or showing the features of failure to thrive. So what's next is of course, like I would like to talk about the things, um, important things like what you can say, what are the causes of sorry yes, what are the causes of I told you the pattern. Okay, one thing is like failure to thrive pattern. What is the pattern we are seeing, and the pattern can be known by this way that um, by the way, we can put a chart. Okay, I will put a chart here. Okay, so the pattern can be known by this way that for example, this one is growth parameters. Okay, here we are writing growth parameters, and here we are saying like what abnormality you can think of, or you can say what you can say is like most suggestive type of abnormality, okay, which can be seen. So as you can see, for example, someone have decreased weight, okay, decreased weight and normal height, okay, and also normal head circumference, okay. Now there could be this condition. There could be you can say decreased weight, decreased height, decreased weight, okay, with decreased height, okay, but still you can say normal head circumference, okay. There could be this condition, or someone have, because we are studying failure to thrive right now, so we all of them, they'll be having decreased weight, of course, like so. Again, someone have decreased weight, you can say decreased height, and you can say reduced or decreased head circumference, okay. So decreased head circumference, okay. So see, when someone have acute, what you can say, decreased weight, normal height, and normal head circumference, so just the weight is reduced, the possibilities which you can think of is calorie deficiency or insufficiency, right? And the other thing which you can like decreased intake, Okay, can be there. Okay, one of the thing which could be there, the possibility is hyper metabolic uh, state. Okay, or there could be increased losses. So like most of the things are like either there's decreased intake, or like you can say there is no abnormality like endocrinal abnormalities, or like intrauterine insults are there. So someone who have decreased weight as well as decreased height, and now think about structural dystrophies. Okay, now what is structural dystrophies? What we do is like we can check um, their upper body and lower body ratio. I will talk about this one. This one, like I will explain a little more. Okay, so endocrine disorders can be there. Okay, this could be one of the thing, and one of the thing we take the X-ray of the left wrist. Okay, and if you know like the small bones in the hand, basically they ossify at different time. So you can basically calculate the age of the patient or anyone by taking the X-ray of the left wrist of the hand. So that is called as the bone age. And what is your really age is, it is called as chronological age. For example, someone in which like you will see the bone age is basically less than the chronological age. For example, if his real age is 5 years of age, but when you will see the bones of the left hand and you calculate like he have the age of 4 years. So in this scenario, think about like the most common causes: constitutional growth delay. Okay, like uh, like maybe they will catch up later, a little late. Okay, but for example, if the condition is like something like this, that the bone age comes back same like chronological age. So think about familial short height. Okay, so this thing, of course, like when we will study failure to grow. Okay, like someone who is not gaining enough height, we are going to discuss this thing as some like more. Okay, and anyone who have decreased height, decreased weight, and decreased head circumference. So remember about, think about intrauterine insult. Okay, that's the most important thing. Or think about some sort of genetic abnormality. Okay, so this is how we approach or we think about the most possible conditions. Okay, what I was talking about is like structural dystrophies. What we do is like we take the upper to lower body ratio. How to calculate is that the upper segment is considered as when we measure from the top of the head to the pubic symphysis, and the lower segment is from the pubic symphysis to the floor. Okay, so the from the top of the head to pubic symphysis is called as the upper segment, whereas like from the pubic symphysis to the floor is called as the lower segment. So we take the ratio of these two segments. Okay, if the ratio is increased, what it means like the upper segment is bigger than the lower segment. So one of the conditions which can cause this kind of thing is called as achondroplasia. Okay, and whenever this ratio is decreased, like the lower limbs you can say are longer than the rest of the upper body, the conditions can be different syndromes like Klinefelter syndrome, Marfan syndrome, Kalman syndrome, and things like this. So we calculate that ratio to look for these things. Okay, so guys, remember, the most common causes of failure to thrive is organic, right? Sorry, non-organic. So non-organic, like most of the cases, you can say uh, 90% of the times. Okay, and 90% of the cases, you can say, but by the way, more than 90% of the cases, times, the cause is inorganic. Okay, cause, and of course, like in that one, the most important thing is decrease calorie intake. So it could be decreased calorie intake, it could be like the problem with the feeding techniques from by like which mother don't know, or it could be like economic factors like poverty, or parents child relationship problems, or attachment problems, or maybe the there's too much stress, okay, in the family. So many things, or single mother, or like social problems can be there, right? So uh, like of course, like these kind of things, like what should be the management of this thing, how we are going to manage this thing. Very easy thing, guys. uh, uh, like of course, if there is no organic cause, then we uh, like uh, wait so 90% of the time the cause is inorganic. So of course, on the history, you can catch the cause, or after you have done the examination or the investigations, right? You will reach the cause. You would know like what is the cause of that thing. So of course, like it's a team management thing, and like depending on if there is a psychosocial stressor, psychologists can help or social workers can help. If there is diet problems, so you can refer the patient to dietitian, okay. So of course, like the dietitian will tell what to give, when to give, and how much to give, right? uh, for example, if there is cleft palate, which is the organic problem, then of course you are going to refer the patient to surgeon, of course, right? So if the baby have iron deficiency anemia, what you have to do, I think quite easy. Give them iron tablets, right? So, sorry, or iron syrup. So what we do is like we have to do calorie boosting, okay, of the baby, if there is no organic problem, of course. And the goal is to uh, reach, you can say, 90 to, you can say, 110% of ideal body weight, or IBW, ideal body weight, right? So of course, like many things can be done. So the management of most non-organic failure to thrive is basically, you can say, multidisciplinary teams are there, okay. Of course, the primary healthcare provider, psychologist, dietitian, social worker, okay. So all these teams are involved, and then they work together to deal with this condition, okay. So education, a lot of education is given. um, uh, Pediatric dietitians are basically present in, of course, developed countries, where they can tell what to do, okay. So hospital admission is like not necessary in most of the cases, but it is only necessary, if the child is less than six months of age, and you have to refeed the baby in the hospital, okay. Of course, by directly observing and giving the child feeding, okay, and just to see what is the outcome and how the baby is, what you can say, performing. So that thing is important. And of course, like when the cause is organic, guys, okay, which is 10% of the time, so you have to, um, you can say, treat the underlying cause in organic causes. For example, someone have celiac disease, treat that. Someone have um, congenital heart defect, treat that. Someone have vomiting, treat that. Someone have malabsorption, treat them. Someone have inborn error of metabolism, of course, treat them. So of course, treatment is done in that one, okay. So uh, of course that thing is done, okay. So by the way, malnutrition is very common around the world, if you know, like WHO says that, like directly or indirectly, like about a third of all the deaths, of children under 5 years of age is like due to malnutrition, okay. So, and nowadays, by the way, even in developed countries, malnutrition is a common thing because of neglect and poor education, and sometimes poverty as well, because developed countries, they are becoming very much expensive. So people, they couldn't find enough money to feed, or to give the good diet to the babies, to their babies, of course, okay. So like whenever the babies come, we always do a nutritional assessment. I already show you that thing. We can take like what kind of measures, and laboratory investigations we can do, okay. Because malnutrition generally can give rise to a lot of things, lot of problems, right? like rickets or kwashiorkor or protein energy malnutrition, which we'll be discussing in coming lectures, of course. So, of course, uh, uh, their brain is developing, so they need like good amount of diet, okay, just for um, like their proper growth, right? So this thing is important. Like babies should be given, 3 meals and 2 snacks each day, and like the way to increase their energy, and they must be offered a variety of food. They must be given good amount of fats, like creams, cheese, butter, okay, and we what you can say, uh, you can say we should discourage them to drink more and more fluids like colas and these fizzy drinks, okay. And ideally they should eat the meals at regular times, of course, with family members, and um, a very good way is to praise them when they eat the food, okay, never force feed, okay, but never create any conflict if the child is not eating, because that leaves a bad impression. So opposite to FTT, what can be there? Obesity, right? So obesity is like opposite to what you can say, uh, malnutrition. Obesity can simply be defined as body mass index more than 95th percentile of um, age and height. Okay, so now to tell you about obesity, guys, uh, you know, if both parents are obese, there is 80% chances that the child will be obese as well. So genetic, you can say, factors play a lot of role, okay, in obesity. When the parents are obese, so the child are obese as well. And of course, it can be associated with certain syndromes, uh, there is one thing called as Prader-Willi syndrome or Turner syndrome. They are fat, okay, and certain conditions, for example, hypothyroidism can give what you can say obesity. And nowadays, by the way, uh, there are other causes of obesity as well. So anyhow, remember, I will say this thing: uh, complications of obesity is same in both in all age groups almost, okay. So don't think like, if your child is like obese, that's good. Why? Because they are equally uh, susceptible to get hypertension, dyslipidemias, um, type 2 diabetes mellitus, obstructive sleep apnea, gynecomastia, in females, polycystic ovarian disease, irregular menses. But the things which are specific to the pediatrics is, for example, there will be a one condition which will be studied called a SCAFE, which is basically slipped capital femoral epiphysis. Slipped capital femoral epiphysis, right? So SCAFE can occur, like especially when they are in their teenage, like 12, 13 years of age, like this, 14, 15, okay. So what happens, like their femoral bone, the epiphysis that gets slipped due to like too much weight. One of the things which children especially get a lot is psychological trauma, uh, like school bullying, okay, like they are the one mostly bullied in the school. And when the school bullying is there, guys, these babies, they have low self esteem, okay, and they can be depressed as well. And one very important fact, remember that childhood obesity persists in adult age as well. So better to not leave this thing, rather tell the child to be more active, okay, and be more mobile. So many of the things, okay, how we do or how we treat this thing is like by education, okay, education of the family, by the way. Encourage the family, educate them, tell them to change their diet, okay. um, what you can say, uh, of course, like not like the adults, where what adults do, like they use special diets or not, but you can make qualitative changes, not quantitative changes. It's very hard to limit the quantity of the child food, okay. So just limit the quality. Like don't give him fast food, of course, like give him some nutrient rich food, okay. Like nowadays, like the food is mostly calorie rich, not nutrient rich, so rather giving them calorie rich food, give them more nutrient rich food. So like of course, like ask them to increase their activity, uh, and there are different ways to do that nowadays. So increase their activity, change their eating habits, change their meal patterns, and involve a dietitian, okay. Dietitian should be involved. They will make a plan for them, okay. Counsel them about that thing. Surgery is not used in children, okay. And nowadays, of course, like a new thing is there. uh, um, for example, I would like to write here: increase their activity and limit their screen time. Now, if you will see your iPad or iPhone or like any phone, whatever you have, you can see like how much screen time you had in the last week. And nowadays they break it out as well: how much you spend on social media, how much you spend on browsing, how much you spend on music and stuff like this. So the children should limit this like screen time. No TV or video games or this smartphones or gadgets things. Rather, they must be encouraged to go for more and more physical activity, at least 30 minutes a day, things like this. So that's all for today lecture, guys. So see you next week with a new topic. Okay. So we will be starting, I think next week we are going to start with cardiology. Okay, I'm going to start with the cardiology, the first thing after finishing these common conditions of in pediatrics, or common complaints in pediatrics. Okay, so we are going to start with cardiology. Thank you so much.